On today's video, we'll be taking multiple choice question under the body fluid physiology. If this is your first time on my channel, kindly click on the subscribe button so you'll be notified when I drop a new video. So the first question in this series starts like this. Number 1. Most of the volume of normal human blood is composed of dash. A. Red cell. B. Hemoglobin. C. Plasma. D. White cells. So let me give some time. What do you think is the answer? The right answer here is plasma. Number 2. Antigens are dash. A. Found on the surface of red cell. B. Kind of molecules that identify a blood type. C. Relatively large carbohydrate molecules. D. Option A and option B. So what do you think is the right answer? So the right answer to this question is D. A and B are both correct in this question. Number 3. Which of the following are likely to increase in quantities when the body is under attack from bacteria? A. Erythrocytes. B. Leukocytes. C. Thrombocytes. D. Blood plasma. So what do you think will be the right answer? Don't forget to subscribe. So the right answer here will be B. Leukocytes. Leukocytes are your white blood cells. Number 4. Which of the following is abundant in red blood cells? A. Glutamine 1. B. Glutamine 2. C. Glutamine 3. D. Glutamine 4. It is a very common multiple choice question, and the right answer here is A. Glutamine 1. Take note of that. Number 5. Osmol per kg of water is known as dash. A. Osmolarity. B. Osmolarity. C. Both of them. D. None of the above. What do you think is the right answer? Well, the right answer in this question is B. Osmolarity. If it was osmol per liter, it would be osmolarity. So know the difference. Do not confuse them in your exam situation. Number 6. Which of the following is present in least quantity in ICF? A. Potassium. B. Phosphate. C. Magnesium. D. Calcium. So what is the right answer? The right answer here is calcium. Calcium in ICF is almost or equal to 0. Number 7. Average blood volume of adults is A. 5% of total body weight, 7%, 9%, or 11% of total body weight. What do you think is the answer? So the right answer to this question, without wasting much of your time, is B. 7% of normal body weight. So under standard conditions, the normal or the average body weight that they're referring to here is a 70 kg man. So 70 kg. Number 8. Insensible water loss of average adults is about dash. A. 500 milligram per day. B. 600 milligram milliliter per day. 700 ml per day. 800 ml per day. The ml means milliliter. That is the 1,000th of a liter. So the right answer to this question is 700 milliliter per day. Number 9. Osmolarity is measured by dash. Dilution method, spectrophotometric. C. Cryoscopy. D. Electromagnetic method. So which of this is used in measuring the osmolarity? So the right answer to this question is C. Cryoscopy. Major cation in ECF is dash. A. Sodium. B. Potassium. C. Magnesium. D. Calcium. So the following is the main cation in the ECF. The ECF, the extracellular fluid, and the right answer is sodium ion. It's over about 142 in the plasma and 139 in the interstitial fluid. Which of the following is not a characteristic of marker substances? Sorry, this term here should be substance, not acceptance. So my apologies for the mistake. A. It should not change the color of the body fluid. B. It has to be toxic to be effective. C. It should not alter the volume of the body fluid. D. It should mix well with the fluid compartment within a reasonable time. So what do you think is the answer? Let me give you some few seconds to get your answer. The right answer to this question is B. It has to be toxic to be ineffective. So that is not correct. It's wrong to be getting the right answer in this question. Number 12. Which of the following is not a type of dehydration? A. Mild dehydration. B. Average dehydration. C. Moderate dehydration. D. Severe dehydration. So the right answer here is average dehydration. It's not correct. We only have mild, moderate, and severe dehydration. Number 13. Compared to the intracellular fluid, the extracellular fluid has a high concentration of A. Protein, B. Phosphate, C. Calcium, D. Magnesium, E. Potassium. So what do you think is the right answer here? So the correct answer is calcium. There is almost zero calcium in the intracellular fluid. Edema is due to low colloid osmotic pressure of plasma and is caused by dash. A. Heart failure. B. Arterial dilation. C. Liver disease. D. Venous obstruction. E. Inflammation. So the following cause edema. So the right answer here is liver disease. For 15, drinking 1 liter of pure water is expected to A. Induce a greater increase in the volume of ECF than ICF. B. Induce a greater decrease in osmolarity of ECF than ICF. C. Induce an increase in urine flow. D. Induce a greater increase in volume of plasma than interstitial fluid. E. Induce a greater decrease in osmolarity of plasma than interstitial fluid. So what do you think is the answer? What do you believe is the answer? So the right answer here is B. B is the right answer to this question. Number 16. The interstitial fluid A can be measured using insulin. B is lower in volume than plasma. C has a higher sodium concentration than plasma. Has the same protein concentration as plasma. E has slightly a higher concentration of chloride than plasma. So what do you think is the right answer here? So the correct answer in this question is E, has slightly a higher concentration of chloride than plasma. But 17, the substance that contributes most of the intracellular osmolarity is dash: A, protein; B, phosphate; C, potassium; D, urea; E, chloride. So the right answer to this question is C, potassium. When you see a question like this, what contributes the most of the osmolarity of a particular fluid, be it plasma, interstitial, ECF, or ICF, what they're asking you is what is the ion that has a high concentration in that particular fluid? That was they're asking you indirectly. Number 18, movement of fluid from the interstitial space to plasma is due to A, blood pressure in the capillaries; B, plasma sodium concentration; C, plasma potassium concentration; D, plasma protein concentration; E, plasma pH. So what do you think is the right answer in this question? It's a very tricky question. So the right answer to this question is plasma protein concentration. Number 19. The intracellular osmolarity is mainly due to A, chloride; B, protein; C, potassium; D, ATP; E, magnesium. So the right answer here is potassium. Number 20. The chief difference between plasma and interstitial fluid is that plasma contains more dash: A, sodium; B, potassium; C, electrolytes; D, water; E, protein ions. So what do you think is the right answer? The right answer here is protein ions. So the interstitial fluid, the plasma fluid will have more protein ions than the interstitial fluid. I believe the plasma has about 108, while the interstitial fluid has about 106. Number 21. The following are major constituents of the intracellular fluid, except: A, calcium; B, phosphate; C, chloride; D, potassium; E, protein. The right answer here is calcium, A, calcium. Number 22. Which of the following combinations of substances is suitable for calculation of the interstitial fluid volume? Which of the following combinations of substances is suitable for calculation of the interstitial fluid volume? A radioactive sodium and heavy water; B, heavy water and inulin; C, inulin and Evans blue dye; D, heavy water and Evans blue dye; E, Evans blue dye and sodium labeled albumin. So what do you think is the right answer? The right answer here is Evans blue dye and iodine labeled albumin. Number 23. The concentration of Ca, that is calcium, in the ECF is A, 5 mg per deciliter; B, 5 millimole per liter; 5 EQ per liter; D, 25 milli EQ per liter; E, 2.5 picogram per deciliter. So be careful of the units, very tricky. The right answer here is 5 millimole per liter. Number 24. The extracellular fluid differs from the intracellular fluid in that it has A higher osmolarity, B, no protein, C, a lower calcium concentration, D, a higher chloride concentration, E, a higher magnesium concentration. So the right answer here is D, a higher chloride concentration. Number 25. Plasma osmolarity is dash. A, determined primarily by protein concentration. B, determined primarily by potassium concentration. C, determined primarily by sodium concentration. D, normally higher than that of interstitial fluid osmolarity. E, about 250 milliosmol per liter. So the right answer here, what it is, the answer here is C, determined primarily by sodium concentration. Why? Because sodium is the main ion in the plasma compartment. All of the following substances may be used to measure ECF except A, sucrose, B, inulin, C, radioactive sodium, D, advanced blue dye, E, ethyl sulfate. So which of the following is the right answer? The right answer here is sucrose. You can use sucrose to measure ECF. Number 27. The osmolarity of plasma is determined by the concentration of A, glucose, protein and urea nitrogen, B, glucose, sodium and urea nitrogen, C, sodium, calcium and protein, D, sodium and bicarbonate, E, potassium and sodium. So what do you think is the right answer here? The answer to this question is B, glucose, sodium and urea nitrogen. Number 28. A patient is given a small dose of radioactive sodium. Most of this sodium would distribute in A, plasma, interstitial fluid, intracellular fluid, D, joint fluids, D, adipocytes. So what do you think is the answer? The right answer here is quite basic. If you could remember the table, the table where they give out the different measurements of the sodium, the potassium, and other ions in each compartment, you get the answer. The right answer here is A, plasma. Why? Because plasma has a higher sodium concentration than the cell fluid. Plasma has about 142, while the cell fluid has about 139. Number 29. What would be the osmolarity of a solution which is one mole glucose and 1 mole NaCl? A1, B2, C3, D5. What do you think is the right answer? So the right answer here is C3. Why? Glucose will bring 1 mole, while NaCl will bring 2, Na will bring 1, while the Cl will bring 1. Glucose will not dissociate the same way that NaCl would. That's why. But 30, which is our last question. The colloid osmotic pressure of plasma is mainly due to dash. A, globulins, B, fibrinogen, C, albumin, D, lipoproteins, E, sodium. What's the right answer? The right answer here is very simple. It's a very common question. The answer here is albumin. Please don't forget to subscribe to my video to get new updates. Thank you.